Hello, and thanks for tuning in. I'm Aline Sigler. I'd like to talk to you for a few minutes about overpayments to physicians and critical access hospitals discovered during an audit by the Office of Inspector General, or OIG. Who is the OIG? Since 1976, the Office of Inspector General has been at the forefront of the nation's efforts to fight waste, fraud, and abuse. They also work diligently to improve the efficiency of Medicare, Medicaid, and other Department of Health and Human Services programs. Let's take a look at how critical access hospitals are paid. Under the standard payment method, critical access hospitals, or CAHs, are paid a facility fee for furnishing outpatient services. The CAH is not paid for any costs of physicians or other professional services. A CAH may elect the optional payment method, sometimes referred to as Method 2, under which it may be paid for professional services in addition to its outpatient facility payment. Even if a CAH elects the optional or Method 2 payment method, practitioners furnishing professional services to outpatients have the choice of whether to reassign their billing rights to the CAH or file their own claims for professional services through their Medicare Administrative Contractor, or MAC. So why did the OIG decide to do this audit? While performing survey work on calendar year 2019 Medicare Part B claims, the OIG found that critical access hospitals were paid for professional services provided by healthcare practitioners that received payment for the same services provided at the critical access hospital. Generally, Medicare should not pay both a CAH and a healthcare practitioner for professional services. Their objective for this audit was to determine whether those professional services paid to CAHs under Medicare Part B and payments made to healthcare practitioners for the same services complied with federal requirements. The audit covered 40,026 Medicare Part B claims, 20,013 claims submitted by CAHs, and 20,013 claims submitted by healthcare practitioners for the same professional services provided to the same beneficiary on the same dates of service. The audit period was from March 1st, 2018 through February 28th, 2021. For these 40,026 claims, Medicare paid CAHs $1 million and paid healthcare practitioners $872,858, so roughly $1.9 million. After reviewing the regulations for reassigning professional billing rights to CAHs, not all the services audited complied with federal requirements. We established that CAHs and healthcare practitioners each submitted an equal number of claims in the sample. However, for each date of service, only one of the claims was correct. As a result, Medicare Administrative Contractors paid providers $907,438 more than they should have, and beneficiaries were held responsible for $281,321 more than they should have been. To break this down, 12,156 claims from critical access hospitals who billed and were paid for professional fees when billing rights were not reassigned totaled $331,448. The remaining 7,857 claims were from professionals who had reassigned their billing rights to a critical access hospital, but billed the charges separately to Medicare, and we reimbursed a total of $575,900. The OIG believes these overpayments occurred in part because CMS did not have claims system edits to prevent and detect duplicate professional service claims for the same date of service, beneficiary, and procedure. Regardless of whether or not there are or should have been edits in place to catch these claims, providers are responsible for correctly billing according to the Medicare regulations. As a reminder, the CAH can only bill for services if the provider reassigns their billing rights to them. Once the reassignment has been given to the CAH, practitioners must sign an attestation that clearly states they will not bill Medicare Part B for any services furnished in that hospital's outpatient department. This is stated in the Medicare Claims Processing Manual, Publication 100-04, Chapter 4, Section 250.2. So what were the resulting actions after this audit? Medicare administrative contractors took back the funds that were paid in error, and providers refunded any associated deductibles and coinsurance collected as a result. MACs also recommended that any relevant providers make a diligent effort to identify, report, and return any other additional overpayments. For more information on this OIG audit, see Report A0621-05003. You can find a link to it and other resources in the description for this video. Take a moment now to complete a brief survey and give us your thoughts about this video. You can scan the QR code shown here, or you can use the link in the description below. We look forward to your feedback. Like and share this video if you found it helpful, and make sure you subscribe to our YouTube channel so you get notified when new content is available. Thanks so much for joining us. We'll see you soon.